Hello and welcome back to the latest episode of the TraumaTalk podcast. Today I'm delighted to be joined by Cheyeanne from Lambeth Links and Ignacio from Controlling Chemsex. We're going to be chatting a little bit about an exciting project that we have coming up and exploring the topic of chemsex a little bit more. Welcome both of you. It's lovely to have you on. If you could both just take a moment to introduce yourselves and your organisations and share a little bit more about the fantastic work that you both do.
Absolutely. I can go first. So my name is Cheyeanne. My pronouns are she, they, and I am the project and governance coordinator for Lambeth Links. Lambeth Links, it's kind of in the name. We operate across the borough of Lambeth here in London, and we serve as a forum for all LGBTQI plus people that live, work, and socialise within Lambeth. A lot of our work is more at the systemic level, so we have a lot of good connections with a lot of statutory organisations, such as our local council, the NHS, the Met Police, and some other organisations working within our sector as well. And most of our work is mainly focused on ensuring that LGBTQI plus people have the ability to live their lives freely without fear of discrimination and harassment, and also to ensure that they are able to live in a way that respects their health and well-being and to achieve better outcomes for them.
Great, thank you. And Ignacio?
Oh, hello, my name is Ignacio Labayen de Inza. I'm from Spain originally, but living in London since 2008. And since then, I have been supporting people struggling with chemsex, working in different organizations. But in 2020, just before COVID, I founded with two colleagues this organization, Controlling Chemsex, which is supporting anyone who is affected directly or indirectly by this phenomenon. And I am also a survivor of chemsex myself, and the majority of the people in our team, they also had to get over chemsex issues that they had in the past themselves. So very happy to be here, and thank you for your invitation.
No, thank you. Great. Well, how about we start with sharing a little bit about the project that we are collaborating on. So Lambeth Links have initiated a project to support people who are struggling with chemsex through the Remind app. Cheyeanne, do you want to talk a little bit about the background to the project?
Yeah, absolutely. I think maybe it might be a good idea to perhaps maybe talk about what chemsex is as well. I know that when I've talked to a lot of colleagues and friends, they've kind of been like, what are you talking about? So I'm not sure if I'm best positioned to kind of give that explanation. I'm not sure if Ignacio, if you had a bit more of an explanation for what chemsex is.
Sure. Well, chemsex is the term used to describe the sexual activity that happens when someone has been taking drugs with the intention of enhancing, facilitating, lower inhibitions, or making just the experience more intense, the sexual experience more intense. So I can have sober sex, I can have chemsex, So we are talking about this term that describes the sexual activity.
Mm-hmm. Thank you.
And it's affecting mostly members of the LGBTQ plus community, but now we can see that it's also spreading to other communities.
Mm-hmm. Yeah, and I think that spread is kind of one of the reasons why Lambeth Links wanted to work on this. So we operate within the borough that has the second highest LGBTQI plus population in the UK. So we know that chemsex for a lot of people living here is an issue and is a problem. And a lot of people have found it really quite difficult to access care and access help in order to address kind of the issues and the trauma that is associated with chemsex. And it is, again, one of those kind of things that it crosses the borders in our sector. So for a lot of people, when it comes to substance misuse or it comes to sexual health, no one really wants to take responsibility for the care that's required for the people that do have trauma associated to chemsex. So Lambeth Links, we've kind of looked into this a little bit. We realized it was definitely a problem that wasn't going away. It was rising within the borough. And we reached out to Freya, and we thought it would be a wonderful idea to have something that was more close to a self-advocacy tool, or something that people who didn't feel necessarily comfortable or were unable to seek in-person help, or weren't able to access help or care from medical services, were then able to have access to an app that was then helping them to address the symptoms that were associated with their with chemsex experiences, without having to face any of the stigma or any other adverse effects that might be associated with seeking that medical care. So yeah.
Yeah, exactly. And so the app provides grounding tools to help people when they're struggling with their symptoms of trauma. It also enables people to track their feelings, symptoms, and triggers so that they can start to see any patterns, and also has journaling functionality so that they can reflect on how they're feeling, and has some information and resources in there too. And as part of the pilot, we're conducting a couple of surveys so that we can understand people's experiences surrounding and related to chemsex better. And with those insights, we're aiming to be able to produce a report, a new report that can also push and help to campaign for better support through healthcare services and so on, other local services, to better support people who are struggling with their mental health as a result or because of their engagement within chemsex. So I think what might be a good idea now is to chat more. Ignacio described what chemsex is, but how about we talk a bit more around the reasons why people get involved in chemsex in the first place? What's the draw for people? Fun, exploration, escapism.
Yeah, well, before anything, I want to tell you that I'm incredibly happy that you are providing these providing resources, because trauma is something that not everyone is talking about, but it's probably something that everyone who is involved in chemsex suffers in one way or another. We are talking about scenarios where there is very, very easy to suffer from sexual assaults. You can see situations that can be very, very traumatic. You can be having legal problems, or you can be blackmailed by others who are trying to get something from you. So this is a very, very important matter, and I want to insist on how much we want to support you, because I think the community in general is going to get lost from this. Regarding your question about motivation, the reason why people start, I could say that there are many, many reasons, and why the gay, bi, well, the queer community is so vulnerable. I would say that the main one is loneliness, and is someone might be thinking that we were going to talk about people who were sexually abused when they were children, and it's true. But loneliness is always connected in one way or another. We hear people about, I got here because I was new in the city and I didn't know anyone, so I went on Grindr and started to meet people. We hear from people who they broke up with. I broke up with my long-term partner and I didn't know how to meet others. Loneliness is one of the biggest consequences of getting involved in chemsex, because I stopped seeing my friends, and I start to engage only with people who also do chems. This is one of the main reasons, but we also have to talk about fear of rejection, psychosexual issues. There are people who are using chems. Let's say, for example, that I suffer from premature ejaculation, and my sex life has been always very, very embarrassing, because every time I tried to have sex, I didn't last for very long, and every time I felt really, very inadequate. So one day I try something, it's called meth, Dina, or I try mephedrone, and then I can hold my ejaculation. I think this is amazing. There are many other psychosexual issues, people who are struggling with lack of libido, but if I take these drugs, I will feel hornier. People who are experiencing problems with painful sex. I like to be a bottom, but I cannot be a bottom if I don't use something. There are also elements of intimacy and connection. I don't know how to be intimate, but I know how to have sex. Sex is very available. You go on apps, you can be having sex with a complete stranger in 10 minutes. Well, if you are lucky, sometimes you can be the whole night trying to find someone. But there is all these elements, they are important. We have to talk about very high standards in this community that your body has to look this way. You have to be young. You have to be handsome. Not everyone is like that. So if you go to a sauna, for example, which is a venue where people are having sex easily, you go with a towel. They give you, when you go to the sauna, they give you your towel and they give you a locker. You put your stuff there, and then you have to wander around the sauna just with a towel. And maybe you are very aware of your body, or you think, I'm old, no one is going to love me, no one is going to like me, everyone is going to reject me. But one day you try something, you try chems, and then you feel confident, you feel powerful. Now if someone rejects you, it doesn't matter, there are many other people around. So next time I go to the sauna, why I'm not going to go if I'm not getting high. So there are many elements. We also have to mention boredom. Boredom, not necessarily because I have nothing to do. Maybe my life is not exciting enough. And then one day I try and I go to a place where there are many other people naked and everyone looks happy and everyone looks very open and very, with very little inhibitions. And then my weekend comes next week and I think, am I going to be on Netflix having the opportunity to go to to have something very exciting? So there are many, many reasons. And if you put all of them together, explains why our community is so vulnerable, because there are many problems with self-esteem, fear of rejection, um, HIV, trauma. So you put all that together, and you also put apps, and you also put these drugs that are now in the market, and all this together is what makes chemsex what it is today.
And it's such, I mean, you described there such a huge range of motivations for people to explore and get into chemsex, and all the way through from challenges that people have already had to looking for some fun. And if people are looking for chemsex, where do they typically go to find it? And is it that people typically start taking drugs and get into chems first, or is it that people find chemsex and that becomes part of their life?
Well, it's very interesting. The question is very interesting because I started using chems myself because I had been taking drugs before. I was going to clubs. You get used to taking drugs very easily. There are environments where people take ecstasy or they take cocaine or they take, and then you start to be very open to try many other things, and you will find it's a matter of time that you will find many other a different reality, which is chemsex on your way. There are people who they have never taken drugs and they go on grinder, they are having sober sex, they're having a normal life, but one day they are invited by someone who they like very much because someone very sexy and very hot to go to his place. You go to his place, you like the guy, he's offering you something. You don't want to say no because maybe you feel a little bit intimidated, or maybe you just want to be like and you say, okay, I'm not going to say no. So you start to normalize a new reality that is out there and is happening. Cheyeanne was saying Lambeth, Kennington, Clapham. This in this area. You go and grind now that is 4:30 and it's Wednesday, and you will find lots of people who are using chems, and you think, but people don't work. Some people they work, and then when they finish that work, they start using chems, or maybe they are working from home, or maybe they didn't go to work today. But this area, Lambeth, Kennington, Elephant and Castle, is incredible what is happening there. So the reality is that chemsex is getting worse. We were together with public research company called Opinion. They did this public research in January, and the outcomes were incredibly concerning. We actually we were expecting them, but this, I mean, they were asking everyone in the UK about the awareness of chemsex, and the results were 16% of the queer community. When I say queer, LGBT, 16% of them, they have never heard the word chemsex. 36%, they heard about that, but I don't really know what that is. Yeah, someone mentioned something. And 75%, 3/4, they don't think that chemsex is a problem. We have other bigger problems. We have discrimination, we have safety. I completely understand that they are problems, but that this is something that we need to address. But the problem is that lots of people who they are completely unaware of what chemsex is, they will get into that thinking, well, I don't even know what that is. So what is this? This is something called G. And then you drink it and you think, well, drugs are people who inject. I'm not injecting. They are not. This is not drugs. And then you start little by little, you end up normalizing. You end up going to places where people are high. You end up going to places where people are injecting drugs. And then the first time is shocking. The third time is part of the scene. And so this is what is the most concerning thing, that chemsex is getting worse, and we are talking about chemsex much less than 10 years ago. And this is really scary, because how many times we hear from people saying, if I didn't know that if I was having chemsex, I was going to get to a place where having sober sex was going to be impossible for me. But now I am in that situation. Or I didn't know that if you take GHB, which is one of the drugs, the most popular drugs, you can develop a physical dependency. Then if you stop, you suffer from terrible symptoms. So they come to us and they say, I didn't know that this. So this I didn't know is terrible, because they find out when the problem is there. And fixing these problems is not always easy. I can tell you that.
It sounds as though, people get into it, and you can kind of quite easily be reeled in and sucked into the scene, and the, I don't know if you'd call it a lifestyle, but kind of get sucked in. And then actually, like you were just saying, if you're experiencing problems or having sober sex is then difficult for you, and then actually how can you get out of it, and how can you find enjoyment and kind of pleasure in sober sex again? It must, and also if you have experienced trauma potentially beforehand, and that was part of the reason that you got into chemsex as an escapism, or like you also mentioned, the negative experiences that people might have whilst they're participating in chemsex, it opens up a whole new world of challenges then for people to deal with afterwards.
Yeah, what I think there is something very important to clarify. Chemsex is not about irresponsible people who only care about drugs and sex. Chemsex is a trap. You go there, everything initially looks very glamorous. If the first time you try is horrible and it's traumatic, you don't repeat. But if it's nice and it's exciting and then is when you will find very difficult to start to enjoying things that you were enjoying previously. And this is about sober sex, but this is about sober sex. This is about going to the cinema and watching a movie. Before, maybe you love cinema. Now going to the cinema on Friday, no way. And there are so many elements that we need to take into account, that when people think, no, gay people, they always use drugs. They always use drugs. They always have sex. That's the way how they are. And I said, no, we are not talking about how things were 30 years ago. 30 years ago, you could be taking cocaine, you could be taking ecstasy. You didn't take drugs that can keep you awake for days without being without eating and without sleeping and forgetting that you have to go to work. You didn't. Our community wasn't experiencing that. I remember in the 80s and 90s when there was this big explosion of heroin and people were dying because of overdoses. That didn't affect our community. Our community were using other drugs to go out clubbing, to socialize, to dance, ecstasy, cocaine. It was when people they get the queer community. We weren't injecting. Now we are because of chemsex. At that point, the ones who were injecting were the straight people who were using heroin. We at that point we were dancing. We were trying to socialize. We were trying to connect with each other because this is what we all want. With the end of the day, we all want to be connected. So these drugs, these new drugs, they are a completely different reality. And now we are seeing in our community what we saw in the 80s and 90s. People injecting, people dying because of overdoses. It wasn't happening before. People going to A&E or people to every weekend, they are completely overwhelmed with all the people who are coming with overdoses, people who have been who are suffering from psychotic episodes. We weren't seeing people who were having problems with withdrawal symptoms and physical dependency. We are seeing this now, and the most horrible thing, I always say the same, is that we have to talk about this. We need to warn people. We need to warn our community. This is happening. It's not fun. If I live with someone who is experiencing problems with chemsex and I can see how his life is going, I won't probably try. But if I'm not aware of this and I go on Grindr and I see sexy guys and I see sexy pictures and then I go and I meet the guy and the guy doesn't even look like that picture and this is the reality. Our community, sometimes we use sex many times to connect. Sometimes I feel lonely. I'm going to have sex and I have done that and I understand that. And if chems are in on the table, this is scary to think. I have no idea how things are going to be in 5 years' time, but I can tell you, with COVID, there was a big turning point. Everything changed dramatically, and I sometimes would think if things have changed in 5 years so much, it's very scary to think how is everything going to be in 5 years' time. We don't know, but it's to start shaking here. We need to get ready.
Yeah, and you mentioned as well that since the 80s and 90s that the drugs have changed and people within the community are now using different drugs to the drugs that were being taken back then. But also you mentioned that people are talking about chemsex much less now than they were 10 years ago. And do you see reasons for or know why these shifts might have taken place?
Yeah, well, we were speaking with someone who worked for the Guardian 2-3 weeks ago, and he said, "Well, we already talked about chemsex 3 years ago, and if there is nothing new, what are we going to say? There is nothing new to say." And I said, "Well, yeah, okay. Well, we will have new news to share soon because there will be one of these. I mean, we had training." We were training one organization in Canada last week, and they said that I didn't know they had someone who was now in jail because killed I think around 20 guys in chemsex context. In the UK, we have Stephen Port, who is someone who killed young men with G, and at that point it was in the news. Now, because everything is, it seems that nothing is happening. It's true that you don't see. I mean, is again, you see the 80s and 90s. You see people who were assaulting others just to steal and to be able to pay the drugs. You are not seeing this. You don't see gay men who are in the street who are homeless. You cannot see that. It's very, very under the surface. And also, when I spoke with, I think it was someone from the BBC last year or the year before, and said, you know what? Now, chemsex, there are two priorities in this country at the moment. One is the elections. I think there were elections, and the other one was the royal family, and that was what matters. That was what matters. And if you there was in 2015 there was a documentary about chemsex. It was made by David Stewart. If you see that documentary today, 10 years later, it's like if you see something vintage. Well, this is not what chemsex is today, And we always do everything we can to raise awareness of this, but not just because we want to be, bringing bad news. Is because people are dying, and people are killing themselves, and people are suffering from psychotic episodes, and they jump from the window from their houses, and people are being raped, and this is why we really, this is not just let's talk about this because we have nothing else to do. It's because there are really people really suffering, and it's we hear stories that you have no idea. We work online, and sometimes I'm working with someone. I have to put my face like this, like if I'm listening, but I'm actually crying because you see very young people who are reporting these terrible experiences, and you think, my God, someone who is 18. If this guy was my youngest brother, or I would kill someone who could something like this to him. So hopefully, and this is why we need to support everything, and this is why we want to support you as much as we can. Absolutely.
Thank you. Yeah, it's just absolutely heartbreaking, and like you said, it's such an important conversation to be having and an awareness to be raising, because ultimately it will save lives. And the more people that understand what chemsex is, the challenges and the risks of chemsex, hopefully the more lives can be saved, which is why the work that you do is so important. This is such a huge topic to dive into, isn't it? And something else that we have touched on already in terms of the different negative experiences that people can have with chemsex. There's multiple different risks involved, and I know, Cheyeanne, that part of the work that you do is around harm reduction. Could you talk a little bit about what harm reduction is, and also how that can be useful with regards to chemsex?
Yeah, absolutely. And I think one of the things that we talk about when we are talking about harm reduction is that a lot of people assume that when we're talking about taking drugs, chemsex, sexual health, things like that, people can usually have a bit of a hardline approach, and they say, oh, well, the best way to not get HIV, for instance, is to stop having sex. The best way to not have a drug addiction is to not take drugs. This is obvious, but when we're talking about harm reduction, it's realizing and noticing and accepting that people will do what they do. They will take the actions that they take, and it's about giving people the tools in order to make safe decisions and to engage in things in a safe way, and to essentially what Ignacio was saying is that a lot of people don't even know what chemsex is, but they might actually be engaging in chemsex without realizing it. So it's about giving people the tools to understand the situation that they're currently in and how to address those things. And that's been really, really useful and quite successful within the sexual health space. So obviously giving people the tools to have safer sex, to understand the risks for STIs and for other things that could come up through unsafe sex or unprotected sex. I think that the chemsex space is lacking in this harm reductionist approach at the moment, because there is that intersection between drugs and sexual health, and that crossover for a lot of people. They don't seem to recognize what happens in the in-between. They see them as two separate things, and they don't realize that when the two interact, that it exacerbates a lot of different things as well. And so for us, it's really, really important that we're having frank conversations like this, because for a lot of people, they don't have the knowledge or the skills to understand the risks that they're taking. And it's not to say that we want people to stop engaging in certain things or to stop doing certain things, but it's about giving them the right pathways and the right choices to make sure that they are safely moving away from the things that are going to cause them harm, and that they are able to help those around them as well. And that's one of the beautiful things about harm reduction, is that if you give people tools and education to help themselves, they're then able to help their friends, they're able to help their families, because they have those tools and they have that knowledge that they're able to then share around and hopefully save the lives of other people that they're close to. But yeah, it's a difficult thing because it does require, particularly at a systemic level, it requires recognition that these things are happening, and a lot of the time people don't want to recognize that things are happening within our community, and they would rather take that hardline approach and push for things to be taken away, a bit more of a punishment focused kind of approach to things. But in doing that, it pushes more people underground, and it prevents a lot of this from coming to the surface. And so it makes it harder for us to see what the numbers are, or what the data is, and to understand how many people in our community are affected, how they're affected. And so it's really, really important that we're able to keep having these conversations so that it stays at a surface level, because once it goes underground, it's so much harder to help people and to understand exactly what's going on.
Yeah, I can completely see that. And I assume another issue or challenge surrounding chemsex is that the drugs that are being used are illegal. And so is there another challenge around that in terms of people coming forward for help, or wanting to put their hand up and kind of say, I need help with this? Is that something that you see?
Well, I think I'll pass on to Ignacio in a second, but I guess I kind of wanted to link this in a little bit to my own experience, just in being a young person in this community as well. Before coming into this work, I didn't really know what chemsex was either. And it wasn't until that I was kind of here that I was able to then see, oh, this is already happening in the places that I go, in my own friend circles and my own networks, but it's not called that. No one recognizes it as chemsex in the moment as well. And so it's one of those things where you kind of associate it, given the fact that it is drugs, you associate it a lot with the kind of intersections that you would normally associate with drug taking or unsafe sexual practices. So a lot of people would say, oh, I'm not engaged in chemsex. That's something that, if you're living on the streets, if you're experiencing homelessness or housing instability, or, other kind of harmful stereotypes associated with drug taking and unsafe practices. Whereas I think the reality is that a lot of the people that we see engaging in chemsex, at least in my own experience, they're just usually people within our community that are partiers. They can be rich, they can be poor, they can be, well-connected people, they can be lonely, they can have plenty of friends. It doesn't seem to sit just within one group. And so I think part of the reason why it is quite difficult for a lot of people to come forward is, firstly, that they don't recognize that what they're doing is chemsex. Within our community, even for a lot of younger folks around my age, in their late teens, early 20s, late 20s, early 30s, there is still a culture, particularly online, that doesn't necessarily celebrate chemsex, but it incorporates it still within the scene and kind of keeps it alive. So it makes it a lot harder for people to recognize that that's exactly what's happening, because it's just incorporated into the general party culture or the general socialization and the way that we interact with people. So that makes it a lot harder for them to come forward in regards to that. And then the second reason is, of course, those intersections as well. So if that is a reality for some people, is that they might have that unstable living situation. They might be sex workers, so that makes it even harder for them to come forward because there's that unsafe legal position that they might be in. There's also people that might not have very solid immigration status as well, which means that they're unable to come forward if they need help, because there is the double risk of not only being punished for use of illegal drugs, but also the risk of being deported or having other action taken against them because of that. So for a lot of these people, they're engaging in chemsex, and then they're stuck living with the trauma that they've experienced because they're not able to seek help because of that. And unfortunately, from the things that I've seen, it hasn't seemed to have changed. And from what Ignacio was saying, it really resonated with me, because I really do think that chemsex is still here, but the language and the way that we talk about it has definitely just shifted and evolved, and it's really kept its hooks within culture, and if anything, I feel like it's become even more normalized than it was before.
Yeah, and I agree with you, because it's true that chemsex doesn't discriminate. You can be very rich and you can be involved in chemsex, and you can be illegal in the country, and you can be trying to survive, and you can get involved with that. Is what Cheyeanne says. This is not just a drug problem. Sex is in the picture. This means that it's not the same if you were using heroin, for example, and you need to find a way to pay your drugs. That if you go to to certain place, you don't have the money, but you know that people will be willing to. Something that is very interesting is that people in general, if you say who are the most vulnerable people in our community, and people will say probably it's refugees because they are not legal in the country, probably sex workers because, and I can tell you, it's people who are using chems because someone who is a refugee and who is also using chems, I can tell you their situation can be much more complicated than just refugees. We see, and this is something very sad because I was speaking this morning with someone who is working for let's say chemsex team of a local drug and alcohol service in one of the boroughs in London. He was telling me what they were offering, and it's interesting because what happened is what is happening everywhere is we only support people who live in this area, and if someone is illegal in the country, we are sorry, but we cannot do anything for them. And then I was thinking of someone who I'm supporting now. He's Brazilian. He's a sex worker. He's not even gay, but he has sex with men in order to make money. Is having a serious problem with G dependency. He cannot go to any place to ask for any help because he is illegal. They wouldn't help him anyway because they are going to say, "Okay, you live in the borough. What is your address?" He can't even go and say that. So we are trying to hold this guy and to find a way. So we will go through a private doctor, and it's terrible because his situation. He cannot go back to his country. He's absolutely isolated. His English is, my God, I can't communicate with him between the Spanish, a little bit of Portuguese, and the guy is absolutely broken. He's 21. And he was telling me when I came to London, I came with this idea of building a life and having a girlfriend and having children, and you hear this and you think, what a horrible experience. So this is one of the reasons why I said that this is spreading to other communities, and not only this. One of our volunteers, he's a trans man, and he has been working a lot supporting trans men, and he said, you know what? There are lots of young trans men who are starting to get involved in chemsex because they want to be affected by gay men, by other men. So they go into that. We have lots of trans girls in our team because we can see that you go on Grindr, you go to certain areas, you find lots of trans who are using chems, and they don't go to traditional chemsex services because they think that they are only for gay men. But there is the straight man who likes to have sex with a trans girl sometimes, and who is getting involved in this. And there are chill outs and parties where straight men are going. They don't like to have sex with men, but because they like drugs and they don't care because they are horny, okay, I go there and I can get up. I don't know. And this is very important to understand. That is why it's spreading. We are seeing now one girl. She's straight. Her whole life was about I'm going to have sex. I will open my legs. And then one day she found someone who introduced her to meth. She got crazy. She said she was with that guy maybe 2 months having very crazy sex. She cannot have a normal relationship anymore. She's constantly fantasizing, masturbating. Or trans girls, they are trans women, sex workers, they are going to their male clients. They are offering these drugs because they just to make them become this kind of loyalty card. If you want to use these drugs because you won't know where else you can find them, you will have to come to me. But these people, they don't know where to go. And it's true that things are changing a lot. One of the things is because it's spreading to other communities. The straight man who likes to have sex with trans girl, he doesn't identify himself as a gay man. A trans girl doesn't identify herself as a gay man. So that is why it's so important. So we need to be very open here. We need to forget about labels. And this is one of the things that they say, let's see how things are going to be in 5 years' time, because now people are using, these Zoom rooms. You go to a Zoom room, there are 200 people, so you go to private and you are having chemsex with from the distance with someone in Australia, and you do this because you are terrified of going to a sex party because you were raped last time, or because you said never again, or because you feel so paranoid that you think I'm not going to meet anyone, so I will be living my chemsex in isolation. And this is happening every day. If you want to try, someone wants to try, go on Grindr wherever you are. Go on Grindr Wednesday tonight at 2 in the morning and try to check what you are going to see. And what you are it's very, very easy to see. We are fighting very, very much to help. And I think, for example, Lambeth link, what you are doing precisely to take care of this, it's important that you are not blind to what is happening in Lambeth, because there are other boroughs. I'm going to mention other boroughs that they said no, that happens in Lambeth. Like this morning, this guy was telling me it's not, because my management in my organization, they think that no, that happens in Vauxhall and that happens in Kennington, but that doesn't happen here. And I said, come on, if this is the approach, if this is the idea, we are not going in the right way.
Yeah, it sounds like it's really evolving, but evolving quite quickly, and especially with tech enabling people to have sex online and with the apps to find people, find sex parties. Does chemsex typically happen one-on-one, or it's at a party, or it's in a group, or what's the kind of setting that people tend to find themselves in?
Well, it can be a little bit of everything. So maybe I like one-to-one because I feel safer. So I invite someone, we play a little bit, and then at some point one of us says, "Why don't we invite someone else?" And when I realize I have 7 people at home, I have suffered from that experience many times. No, groups no, and I was always ended up in groups. It can be in saunas, it can be in sex clubs, it can be online. It can be cruising areas. You go to public places, you go to the park, to certain areas in certain parks, so you have uh, sex in the woods, or you can have sex in public toilets. It's interesting because technology is playing a huge role now. There are WhatsApp groups where you go and you promote your party. I'm going to host a sex party on Friday at midnight. Please, those who are interested, please send me a private. And then they send you, okay, send me pictures. No, sorry, we don't like you. And so now some people said, okay, if I don't want to do games, I'm going to block Grindr, so at least I will stop myself. But how can you block WhatsApp? And I could even tell you many other things that is better not even to say, because that can put other people. This is something that sometimes we have a conflict. When Cheyeanne was talking about harm reduction is true that some people who don't understand think, harm reduction, no, what you are doing actually promoting people to use drugs or to have unsafe sex. It's nothing to do with that. They are going to do it anyway. It
Yeah.
doesn't matter if you say, no, sorry, we are not going to give you fresh needles. So that will stop you from slamming, which is the term used to talk. That's not going to prevent anyone from slamming. What they will do is they will share needles, they will get Hep C, or they will get HIV or whatever. And there are many things that we can see that are happening that I think if I would love to tell the world, guys, be careful with this. But on the other hand, I think if we say this to the world, many people who have never thought about that, those people would say, that could be a very good. So I could tell you, for example, try to be careful because people are raping by this youth doing this. And some people will say, okay, I'm going to prevent myself from doing that. But many other people will say, I can rape people like that. So we have to be holding information and being very careful with what we share, because this is it's just about G. It's about G. It's about other drugs, other routes of administration. Is sometimes I think one day we are going to have to write a book. I mean, if the society in general knew what is happening here, first of all, we would have the opportunity to fund our service properly, because every time that we apply for grants, not every time, but a big number of them, they when the funders, they check what is this thing called chemsex, and then they read, and it's about drugs, and it's about sex, and it's about gay sex, and it's about trans, or that's too complicated. And then they go and they find children, or they find animals, which is very nice for them, lucky them, but it's not a glamorous area to support. And our clients, we support them, and then a big number of them, they carry on with their lives and they don't look back. So it's not that they say we are going to support you, and then we hear from them 2 years later saying, hey, can you help my friend? And we say, yeah. So this is also a big problem that we have. Having a charity with a name, Controlling Chemsex, it was a risk. It was a risk because there are going to be people who, for example, they won't donate because they don't want that to be in their statements. And there are people who they don't follow us on social media because they don't want to be associated with that. And I understand. And when we made the decision of finding a name, we knew that we were going to have to give up that. But we also knew that we were going to be very easy to find, you know. So it's very complicated in any way. Apart from what is happening to our community, is why we are a team of I think we are 50 or 60 people involved. Thanks God, because they are volunteers and want to help. We have to work online because we can't pay a venue, and we have to be always fighting. We have to pay DBSs, we have to pay insurance, we have to pay all the psychosexual therapies that we do have. This is not free. And this is one of the consequences of the little awareness of chemsex. If people knew more, they say, okay, let's help these people, bless them, poor people. They work 7 days a week with, this is where we are.
Yeah, incredibly challenging in all kinds of ways. And
Exactly.
like you said, it's incredibly difficult funding charities, and some charities it's difficult to get funding for anyway, but especially when it's a topic that's typically taboo and people don't want to know or don't want to talk about, makes it even harder.
Exactly.
But
Yeah.
also even more important that charities get funded for the work that they're doing, because otherwise where can people go for that help and support? Can you share a little bit more about what Controlling Chemsex does and the support that Controlling Chemsex can offer people?
Sure. Well, everything that we offer is for free. We don't charge anything to our service users. We have different services. We offer one-to-one support, weekly one-to-one support with people who want to make changes, people who want to stop, people who want to reduce their regularity of their episodes, or people who want to stop changing some behaviors. We offer psychosexual therapy, which is this therapy. Normally, if you go in private, is going to cost you maybe 80, £100 a session. We offer this for free, and it's for people who are using because of psychosexual issues, as I said, premature ejaculation, lack of libido, intimacy, relationships, all this. We are supporting people affected by the chems use of a loved one, so we are supporting parents, brothers, sisters, partners, husbands, wives. We have a program that is on Grindr. I think you receive these interventions on Grindr. So we have different profiles set all over London to give information, advice, and also to signpost people to our services. We are training other organizations. Sometimes we are contacted by coroners who are investigating people who died and they don't understand chemsex, so they contact us to see if we can go and give them perspective. We have a daily program for people who need something more structured than just weekly support. We have a peer mentoring programs. Every time that we identify something that we can provide, we go for that, because we can be average. The community needs us to be ready and in taking action. So we are very easy to find. If someone wants to find us, controllingchemsex.com. You will get all the information. Something important as well is that everything that we offer is completely confidential, to the point that when someone is contacting us, we are not going to start asking phone number, where do you work, who is your GP, are you living with HIV, since when, what kind of medication you take. We don't really need any of that. So the only information we need from people are an email address that we can use to communicate. So maybe the email address is I like flowers at gmail.com. So it can keep people anonymous. And the reason why is because we could see that there are many people who they feel paranoid. They are scared of what kind of information are you going to share. And that was preventing lots of people from asking for support. This was one of the reasons why Controlling Chemsex was born, because we had to start to remove obstacles to people who are already finding lots of problems to get support. So everything is confidential until to that place. Sometimes I'm working with someone who tell me, call me John, is not my real name. And I say, well, John, I don't really need to know your real name. You know, when we have our assessment, the only thing we ask is, tell me everything you think I need to know to understand your situation. I don't need to know where you live, and that is incredibly important. We work 7 days a week. We cannot work 9 to 5 because there are people who are using games who work 9 to 5. So we have to work. I have sessions sometimes at 9, 10 in the evening. I work Sundays, and I'm not the only one. We are doing as many of us, and this is necessary when someone is contacting us and says, I'm working 6 days a week. We will have to find a way to see that person. We can say, no, sorry, it's because we only work Monday to Friday. The community work that they don't only work that Monday to Friday. So this is our spirit and our vision, and it's exhausting, but it's also very rewarding. We are training 21 new volunteers. Part of the training involves shadowing, so we are having a session with a client and they are shadowing the session, and then they see very tragic um, situations, and they say, how can you be dealing with this? Is because we see the one who is living a tragic situation, but you are going to see how the work that we are going to do is going to make a difference. And you see the person who is, I think 7 or 8 of these 21 new volunteers were actually service users. I remember them. I say, oh my God, and I'm so happy for them. I say, I remember when you were coming and you were presenting this and that, and they say yes, and here I am now learning how to be a volunteer. That gives you everything, nothing more than that, nothing better than that. Very few things better than that, you know.
Yeah, that must be incredibly rewarding.
It is.
And
It is.
such a huge range of services that you offer as well, not only for individuals who are struggling, but also family and friends. And I just wanted to touch on that briefly, because if someone is participating in chemsex themselves and struggling as a result of their participation in chemsex, that can have a knock-on impact into their life, right? Work, friends, relationships, but also the people around them. And I just wondered if you could share a little bit more insight into that. And if people, either themselves or their friends or a loved one, someone in their family is struggling, what can they do to support them, or how can they reach out?
Well, the reality is that chemsex wants to take everything away from us: our mental health, our sexual health, our finances, our relationships, our families, our jobs. And that also has clearly an impact on families, because sometimes families, they don't realize. I mean, when I was very much using games, my family didn't know because they were in Spain and I could cover that easily. My mom was surprised because we used to talk a lot, and then when I was using, we weren't talking so much, but I told her that I was busy and I was working. They never realized. They realized because finally I ended up telling them. But there are some people who can hide this. There are some other people who cannot hide. If you live with your parents, or if you have a very close relationship with your brother, and suddenly you are behaving very weird, and you don't live with your brother, but you don't answer his messages for 3 days, and it's going to impact on others' lives. Our safeguarding lead this is a very interesting thing. He went yesterday to a course for safeguarding. He was telling what we are doing, and then someone, and a lady who lives up north in England, who was also doing the course, he contacted him after the course saying, "My son is doing this. I don't understand anything. Can you help?" She didn't know that we existed. She didn't even know that there was something called chemsex, but she knew that her son was using drugs and having sex with strangers, and she was completely desperate because she doesn't know if she should kick her son out of the house. The son, you get to the point that you feel so horrible about yourself that you think, well, you know what, maybe it's better that they kick me out. I don't want to hurt my mom because I always promise her I won't do this again. But when I feel lonely, when I feel this, when I feel that, I cannot control myself and I live with shame and I live with guilt and my mom is angry and is frustrated. It's horrible because when you are using chems, it's not that you are not aware of that. You know you are hurting people. You promise yourself never again. I'm not going to do this. I saw my mother or my father crying on their knees, begging me not to, and I try and I promise you I try and I try 1 week and it's very hard, but I try second week and it's very hard, but suddenly I receive a message from someone on WhatsApp who I met in the past and I think, okay, I'm going to go just for a couple of hours. No one will know, and it's not for a couple of hours, and then no one sees these 2 weeks when you have been fighting like crazy. Everyone says, okay, he is again because he's a junkie, he's a drug addict, and what can you do? You have to kick your son out. This is what is the normal thing to think. You need to protect yourself. You have to ask your son to leave the house, and not son. One of my best friends, someone who I he helped me a lot in when I was in one of the most difficult periods in my life. He's now struggling a lot with chemsex. I pray for him every day because he feels that I'm disappointed and he doesn't deserve to get any help. And I have told him, I said, whenever you are ready, I will be here for you. Always, day and night, 24/7. And I know that probably one day he will be dead, and I won't have years to cry enough. So, but this is the reality. You cannot help anyone if that person doesn't want to be helped. Even if it's your partner. It's like when you go on rehab. It's like, okay, I'm going on rehab because my partner has told me that if I don't go on rehab, we will finish the relationship and I don't want to lose him. I go to rehab 3 months, I come back, everyone, wow, you look great, you're fantastic, wonderful work. And then I start to feel lonely. I start to feel horny again. I control myself 1, 2, 3 weeks, 1 month, but one day, finally, for some reason, I meet someone, and everything goes back. And then my partner, after all the money that we have spent, look at you, you're crazy, is responsible, and that person, the only thing he's feeling is shame and guilt. And this is the reality. The reality is not they don't care about their families, they don't care about their partners. They really care is the only connection they have with some sanity, because the rest is chaos. But people don't understand this, and it's no, it's because how dare you see, she wasn't thinking of sex, was only thinking of drugs. And is what we said initially, is loneliness, is need of validation, is trauma, is lots of things that are, we all can live with that. But if we know that there is something that you take, you will deal with that. Who is the cheeky one who can blame anyone for having to survive with these situations?
Yeah, and so difficult, like you said, it's not that people don't care, and it's not that people don't want to get out of it. People, when you feel stuck, or like you said, chemsex traps people. How you can break that cycle, that's the challenge and the big question, isn't it?
Exactly, and this is why we have to talk about this, and we have to talk about young people who think, nothing happens. Before get information. Don't just listen to someone who tells you, see, it's fun, you're going to feel like a porn star. Ask them, how are you going to be feeling next week? how is this going to affect your mental health? How is this going to affect your relationships, your self-esteem? How is this going to affect how you have sex with other people? It's a decision that can change your life forever, and people are making decisions that change their life forever without knowing, and it changed their life forever.
Yeah, which is why, like you said, conversations like this are so important, so that people can understand what it might be that they're getting into, or how, if they do make the decision to have chemsex or be involved, then they might understand the risks better, and how it might impact their lives moving forward. Hopefully it might make people think twice around whether or not that's something that they want to do, or if actually people have struggled, that they realise that there is help and support out there from services like yours.
Exactly. We always try to spread three main messages. One, there is life after chemsex. Unfortunately, this is something that lots of people, they try, they fail, they try this way, that way, and they think it's impossible, because only the people who I'm interacting with, some of them, they are very in a much worse place than me, and they have been like this forever. So that means that there is no way out, and we want to say yes, there is way out. I'm the living proof of that. I was using G daily for 3 years, day and night, and I was smoking meth practically every day. And I got over that, and I'm very safe, and I'm happier than ever before. The second message is there is support available, because unfortunately some people think there is no support because I went to the local drug and alcohol service. They asked me, what is G? What do you take? I take G. What is that? And I said, there is no support for me. There is no way. Or I go to my GP, and my GP is completely unaware what this is about. And the third message is there is free support. This support is free, because it's very normal to end up thinking, I cannot go to ask for support because I need to go to a private rehab, and every week is going to be £5,000. Well, you can go if you have the money, or you want to go to a private rehab paying that, is there for you. But if not, you don't have any money, we are here to help you, and we help people from minute one. If you contact us today, you will get support from today. That is why we train so many people, because we cannot be a team of 10 and then we start to receive people. So the waiting list is 3 months until we answer an email. We can't do that. People cannot wait. That is why we are constantly training people, and the training is very intense. And if you start doing the training today, you won't see a client at least until in 5-6 months, and it's every week, and there is many things involved in the training, because we can't keep people waiting. And now we are going to be 60, and maybe next year we are going to be 100, and the year after we're going to be 200. We cannot say, no, okay, yeah, enough, this is the most we can. No, we can get there. We can say this is the most we can. We can always do more. And if I look at back how everything started, I say, well, wow, this we have got a lot. But I have to think about that, because I'm always with the daily problems and all that, and I don't have sometimes the perspective. But talking to you now, I think, wow, it's true that we are actually doing more than what my daily life is allowing me to see sometimes. Yeah.
It sounds like you're doing a huge amount of incredibly important and powerful work. Do either of you have any final messages that you would like to share that you feel that would be really important for anybody listening?
Well, the main message is we are not stopping, not because we believe that people. We are not stopping chemsex for one reason. I absolutely believe that there's certain situations that there is no other option apart from stopping. But I'm not going to tell anyone that. The reason why we are controlling is because some people don't believe that they can stop. Some people, they want to reduce. There are different goals. And we, in our organization, we are not the ones who are setting the goals. People come to us, they tell us, this is how I am, this is how I would like to be, but I don't know how to come from here to there. As I said many times, if I'm injecting every day and I'm completely isolated, the idea that I could use once a month and for one night is not going to be very realistic. We have to be realistic here, but there are people who come to us and they said, I want to use once or twice a year, and I cannot say no. So if anyone needs any support, please don't think that we are going to be patronizing anyone. We are not the parents of anyone. We are not teachers. We are not bosses. We are assisting people to take control back. And this is what we do, and this is what we want to do. And if someone who is listening to this, wants to have just a question or just a chat with any of us, the way to contact us is very easy. It's support@controllingchemsex.com, and we will reply the same day.
Amazing, thank you. Cheyeanne, did you have anything else that you wanted to share?
Yeah, and I think I'm so thankful to be able to have this conversation with both of you, and especially listening to you, Ignacio, and all of the experiences that have kind of that you've come across in your work and in your daily life as well. I think one of the things that, from my own perspective and from Lambeth Links, it's really, really important for us to try and create a counterculture, or to create a counter narrative against this, because I feel that chemsex is so embedded within our culture that a lot of people don't even know how to name it. They don't know how to recognize it. And part of that harm reductionist approach is that we want to reach people before they reach crisis point. A lot of people feel that they're not comfortable asking for help because they don't feel like they're worthy of it yet. They don't feel like they're suffering enough to reach for help. And a lot of the time, chemsex is in places where people are, as Ignacio said, like just dabbling in it once or twice every now and then. It's nothing big for them. And for a lot of young people in particular, there is that culture where if you try to help your friends, it's, oh, you're a narc, or oh, don't tell on me, or we're just having a bit of fun. And I think it's really important that for our community that we think about how to change these narratives and how to change the conversations that we have, and that it's not about being cool or anything like that. It's about trying to stay safe and try to say, essentially make sure that your friends and your family are safe as well. Because at the end of the day, you can have fun in so many other ways, and just because this is how it's always been doesn't mean that it's something that we have to take into the future. And for Lambeth Links, we always want to make sure that we're thinking about what can we do now that's going to help us, in what Ignacio said, in 5 years, what we want to think about what this looks like in 5 years. And at this point, if we don't start addressing the narratives around this, the kind of care that we can provide people, and the kind of culture that we're created around chemsex, if we don't start addressing this now, then there is worry and there is concern around what that might look like in 5 years.
Well, for my part, I would just love to say thank you both so much. Ignacio, thank you so much for sharing your stories, both your personal experience around chemsex and also all of the stories from the incredible work that you're doing. It's honestly so powerful to sit and listen to. It's made me feel quite emotional to hear. Your work is incredible and definitely saving lives, as you're aiming to do. And Cheyeanne, thank you as well so much for sharing all your insights and just shared around changing the narrative and how we can try and ensure that in 5 years' time the picture looks different. And I hope that for everyone listening to the podcast, this has been a really insightful and useful conversation and has raised the awareness that we all hope that it will, and also that our project will make a meaningful difference and contribution to all of the brilliant work that is going on in this space. So thank you both so much for such a fantastic conversation. I really appreciate it.
Thank you. Really appreciate it.
Thank you very much for doing this, Priya. Thank you.